we want to thank all of our sponsors here on KRIM, especially our Community Spotlight sponsor, the Shed Kings, Curtis and Anthony, down in Star Valley. Well, good morning, Rim Country. Chris Higgins in the studio. Hope you're having a wonderful Wednesday morning. Today, we are going to be talking about Banner Payson Medical Center, and specifically family medicine. In the studio this morning, we have Dr. Matern, Dr. Renner, and Dr. Dupre. Good morning, doctors.
Good morning.
Wow, that's, 3 doctors in here. Hey. Here we go. So, Dr. Matern, going to be talking, I guess, about family medicine, and Dr. Renner and Dr. Dupre are both in a residency program.
Yeah, right.
And tell us, I guess, a little bit about the residency program, or I guess first, yourself, a little bit about yourself.
Sure.
How you came to Payson and got involved with this program here.
Yeah, absolutely. So I'm a family doctor. Been practicing for a few decades now. I'm not going to date myself. But ever since I graduated from residency, I have been involved with teaching medical students and family medicine residents. And I've worked at a variety of residency programs in Phoenix. I went away to Tennessee for a year to do a fellowship and to get more training in obstetrics. And so I love to practice the full range of family medicine, meaning I take care of inpatients, outpatients in clinic, I deliver babies, I do lots of procedures. And so I love that style of family medicine, and I really love to teach it. And I firmly believe we need more of the old-time, old-fashioned country sort of doctors. And so a really good friend of mine, Dr. Shari Veras, who's our chair of our department in the College of Medicine, was working with Dr. Hunt here in town to take the next step beyond training medical students, which is to start a residency program. And so she was looking for a program director, and it seemed to fit really well with my style of practice and teaching. And so, I was like, yeah, sure, let's do this. So I moved up to Payson to start a residency program for family medicine.
Very nice. Now, just with you describing family medicine and just the broad scope of the practice, it seems like it really fits in rural communities.
Exactly.
How much different is family medicine in rural communities versus metropolitan areas?
Well, it's super different.
Okay.
We really want to have docs that are comfortable working in lots of different areas because of that need and lack of providers that are able to do that. And so that's why it was so important to start a family medicine residency in a rural area so that we are training our residents from the get-go in this broad spectrum, and they become competent and capable in rural medicine, and they're much more likely to stay in rural medicine. So that's the point, is to make the broad spectrum doc that can work in rural America.
And that makes complete sense. So instead of being in a metropolitan area and having residents and telling them, well, this is what you'll experience in a small town, this is what you'll experience out there, just have them in that environment.
Right.
So that is great. So Dr. Renner, how long have you been in Payson?
2 weeks.
2 weeks?
Yeah.
So very, very new.
Yes.
What do you think so far?
I love it. I came down for a second look day after interviewing with this program. I was only here for about 12 hours. I saw the hospital, I saw Noli's. I ended up at Noli's for like 3 hours. I loved it. It was live music and everything. And then I went up north to Pine for about 20 minutes. Loved it instantly. I was like, this is home. This will be home.
Well, doctors, nurses, medical professionals, and coffee.
Yes.
How can you go wrong
there?
So a little bit about yourself, a little background.
Yeah, sure. I'm from Salt Lake City, Utah. I've always loved the mountains. I mountain bike, rock climb, do all the things, snowboard. And but I've always been in Utah. I went to medical school in southern Utah. I went to undergrad in Salt Lake City. And so I knew that if I didn't leave now, I probably never would.
Uh-huh.
And I was told that I need to leave. So
Wait,
at some point.
not by the law.
No, no, I kick out. No. Didn't get in trouble or anything. Just told from everyone else that it's probably best I go adventure. And so I really don't have a ton of ties. I mean, my whole family's there. But I was like, yeah, let's go do it. So I only applied to places outside of Utah. And like I said, I came here and I love it. And I'm not super far. Like, it's a pretty quick fly.
Yeah, I was about to say, it's like, okay, next state over.
That's enough for me.
That's enough. Okay, baby steps, baby steps.
Yeah.
There you go. No, and Arizona and Utah, very similar, you know, the environment, landscape, everything you enjoy, you can pretty much do here in Arizona as well. So that should be fun.
Here.
Yeah. Dr. Dupre, how about you? How long have you been in Payson now?
Well, I've lived in Payson now for probably right about 2 weeks.
Okay, same.
But I do have experience with the area.
Okay.
Fortunately, my mother-in-law lives here, so the idea of moving the family with my 2 boys out here was actually really appealing because they get to now spend lots of time with family and get to enjoy some years with grandma that they wouldn't have had before.
That's wonderful. So is your wife originally from this area?
No, she's not. She is from the Washington State, but spent a lot of her early years in Phoenix, and it just so happens that her mom has a vacation cabin somewhere up here, and we just lucked out with the program. We were looking for a family program that was rural, because I want that training, as this is the type of area that we anticipate practicing when we're done with residency. And this one just happened to be in an ideal location.
So what is your favorite thing about Payson so far? I know it's only 2 weeks, but what has stood out or impressed you?
Well, I will say the people.
Okay.
We had an opportunity just yesterday to visit some patients' homes, and I have never met a warmer, more welcoming group of people throughout my short or brief time in medicine. So I really love how welcoming and how friendly, like how many hugs I got yesterday. It was just great.
There you go. It's always nice to get hugs. Always.
Absolutely.
And Dr. Renner, how about you? What so far is your favorite thing about Payson?
I love the people too, but since you already said that, I'll talk about how much I love the outdoors. I've already been, I think I probably haven't unpacked my house, but I've already been on like 5 hikes. I just love it. I know.
Good.
I had to get outside. Yeah, I just love the outdoors. It's been great so far.
There are some really great places here in RIM country, not that far, but then also other parts of Arizona. I mean, it is just beautiful, similar to Utah, the diversity, just the great diversity that you get in Arizona. So, now, Dr. Matern, how many residents have come through the program so far?
Well, we started, we took our first class last summer. So this is my second class right here. So, and our first class is Dr. Ben Johnson and Dr. Heejin Joe.
Yes, I'm pretty sure I met Dr. Johnson. I think he came in, or met him somewhere.
Yeah. Unfortunately, both of them are down in Phoenix right now, learning in the mothership, as we call it.
The mothership.
Dr. Johnson's doing a rotation at the VA right now, and Dr. Joe's in the neonatal ICU down at Banner University.
There you go. Dr. Johnson, if you're watching or listening, I'm trying to get an appointment down there, a sleep screening. Yeah, with the VA, I just get the answering machine over and on hold.
Maybe he's got it in for you.
Yeah, I have to, maybe I can get his number from him.
Okay.
That's what I thought. I'm like, okay, who do I know? Who do I know? Because that's, usually the way to work it sometimes. Now, so, this is great. I know a lot of people up here and a lot of organizations were very excited about this residency program. Obviously, Banner Payson Medical Center, because the potential of getting doctors, them staying here. MHA Foundation, I know, is a big collaborator or part of this program. They're very excited and everything that's happening. So it's great to see this collaboration of different organizations working together to fill this need, because there is definitely a need in the country for doctors.
Right.
And I would imagine, is it more so in rural areas? Is there a greater need in rural areas? for doctors?
Absolutely.
Absolutely, okay.
Yeah, yeah.
Why is that? What are some of the factors that contribute to that, Dr. Matern?
Well, it's not hard to imagine why you wouldn't have specialists in rural areas, right? So you don't have like a ton of people with a certain endocrinology problem, so there's not enough people to support a practice.
Gotcha.
With primary care, why? I honestly don't know, but I think it is that you need to practice that full breadth and be comfortable in it. And it helps, like I say, if you train in it and you're ready for it. I think if you come into it after having worked in a big metropolitan area for a long time, you don't necessarily have those skills anymore, and so it becomes very stressful.
Also, it sounds like a lifestyle. So
Exactly.
I heard Dr. Renner and also you, Dr. Dupre, talk about lifestyle and why you were drawn to Payson. For you, outdoor activities, just being outside. So everything that a community like Payson offers, where you don't get that in the metropolitan area. I mean, if you're down in Phoenix, you have to head out of town all the time to get on the trails. Or I guess there are some around there, but right now they're telling everyone stay off the trails because of how hot it is. And for you, Dr. Dupre, it sounds like with your family, you want to be in a smaller community. Is that
and we're very outdoors oriented.
Okay,
so
as well.
I think you have to want it, and immediately what comes to mind is that show Northern Exposure.
Yeah, that's true.
Okay,
where the doctor is, basically from New York City and stranded out in Alaska somewhere, and he didn't really want that, but grew to love it. And I think that we're fortunate, Dr. Renner and myself, that we really want to be in this community, in this environment.
Yeah, and as you pointed out earlier, Dr. Matern, the family medicine or practicing in a rural community, you're wearing multiple hats.
Yeah.
So it's not just like you're specializing in one area and you can focus on that one area. So all of your patients that you're seeing, it's just, the same thing, where you guys, you gave a broad range of duties or things that you might be doing over the course of a day or a week, deliveries to seeing children, whatever it is. So.
Yeah, sometimes residents pick family medicine because they just want to do clinic all day, every day. That's not us. So that would be another reason why someone wants more of a bigger city and less of this small town rural practice.
Also, going back to lifestyle, the amenities. There are maybe some amenities that are not offered.
Costco, no Trader Joe's.
Trader Joe's if you want to build a store.
So shopping, entertainment, restaurants, and other things that you find in metropolitan areas.
So it does make it a little challenging when I'm recruiting for residents to sort of pick out those medical students who really understand the mindset of a rural community. Because if they move here and they're not comfortable with what's here, it's tough on them.
Yeah, so I think a big selling point, and you mentioned Dr. Dupre, I would go with hugs. Get great hugs. Come to Payson, get great hugs. But then you might have some that are like, don't hug me. Okay, I don't know you. So that might not be a selling point to some. But I think to most, hey, come on now. Who doesn't like a great hug? That's really good. Well, if you're just tuning in or just started watching our live stream, again, talking to doctors from Banner Payson Medical Center and Family Practice, Dr. Matern, and residents Dr. Renner and Dr. Dupre. I guess family medicine, if you want to just maybe go into a little bit more, what does it look like typically, and you mentioned some of the roles, but just like a typical week, in family medicine.
Yeah, okay. Take it?
No. Well, okay, from my little experience, I still have a lot to learn. But that was a big reason why I chose rural family medicine, because every day is so different, and that's what I love. Like, typically we'll start in clinic, that can go from like 8 to 5, but sometimes it's just half days, or sometimes it's just or you're not in clinic at all for a day and you're out delivering babies or doing home visits, like we did home visits all day yesterday. I don't know, every day is a little bit different. Sometimes you have procedures in your clinic, or like I said, you run to the hospital to deliver a baby. It's always different. That's what I love about it, but I could be wrong.
Yeah, and so
And then, so all of that, and then additionally I teach, so all of my curriculum development, my lectures, just making sure that I'm up ahead of them and, you know, getting ready for teaching them the next thing. But in family medicine, we really, so our focus is all people, cradle to grave. So the newborns to old people, and basically all of the problems. So we are the first point of contact for the patient, and we'll often have to step through the unknown with the patient to try and figure out what the problem is, identify and diagnose. So we're known by other specialties for our pretty good diagnostic skills. We can identify the problem and probably take the first steps in dealing with it. If not dealing with all of it, then we know who to refer to and get help from. And then we're like the conductors. We know where to send patients, and then we gather the data back and help the patient understand where to go or what's happening. So we interpret. What else do we do? We're very, very big on prevention. We want our patients to be healthy. So we're trying to put ourselves out of business. But we want to spend a lot of time teaching about healthful diet, exercise, vaccinations, and any ways that help prevent disease and to keep a population healthy. That's another thing family doctors are very involved in, is population health. We look at the community and how the different things in the community affect individual health, and how can we make the community as a whole healthier.
Wow, and that's a
is a
great
segue.
segue. I know, I brought the flyers up and I thought, you are good, Dr. Matern. Look at this. Segue into a community public meeting that Banner Payson Medical Center is hosting, and that's next Wednesday, June 25th at 12 p.m., and it's in the main conference room. The address is 807 South Ponderosa Street. You do need to register for this meeting, and we put these flyers out on the KRIM Instagram page, also on the KRIM website, krimfm.com, and you'll see them other places as well around the community. So you just scan that QR code, and what Banner Payson Medical Center is looking for, they want to understand what the community needs are, so they can include that or put that in their 2025 Community Health Needs Assessment Report. So they're looking for the input from residents, from you guys, and this is to better serve the residents of the community.
Right, different from these kind of residents.
Oh, yeah, well, thank you. We need to specify, yes, not residents, but yes. People that live in Payson.
The people that live in
People that live in, well, these residents live in Payson now as well.
Now they do
Oh,
too,
gosh,
yes.
well, you guys know what we're talking about. Also, focus group. There's 2 sessions that are going to be held Wednesday, June 25th. And these are focus groups where, again, Banner Payson Medical Center are looking for input. They're Wednesday, June 25th, 2 to 3:15 p.m. or 6 p.m. to 7:15 p.m. Refreshments will be provided. And let's see, why participate? To make your voice heard, share your unique perspective, because there are a lot of different needs in the community. So again, Banner is looking to better serve the residents here in Payson, members of the community, so they need to know what your needs are. Shape local healthcare, help Banner focus on what matters the most and be part of the solution, help inform decisions to improve community care. So again, it's important that there's participation, because you can say, or hey, we need this, Banner needs to do this, they need to look into this. But if people, representatives from Banner don't know,
Right.
then they don't know.
Right.
So it's good to give them this information. And then if you can't make any of those meetings, you can do a survey, an online survey, and again, there's another code for that, QR code, and you can just take that survey online. So Dr. Matern, what would you say you see the most here in Payson as far as in family practice? Like, what are you dealing with, or an issue that you're dealing with the most?
As far as health problems,
Yeah.
probably like the top diagnoses that family physicians in Payson deal with, and it's probably not very different from what family physicians elsewhere deal with, but like a lot of hypertension, so high blood pressure, high cholesterol, obesity, allergies,
Allergies.
colds, and then like your well exams coming in for your shots and your physicals, arthritis, joint pain, a lot of musculoskeletal, so back pain, hip pain, knee pain, shoulder pain.
Pain.
And we deal a lot with that.
Anxiety, depression.
Anxiety, depression, so mental health issues, like probably a third of our visits end up being addressing some mental health issues.
Okay.
Yeah, that's probably the top ones.
And I really like how you described the family medicine doctor as the connector.
Yes.
Or kind of doing the diagnosis and then connecting the patient to the specialist or wherever they should go.
Yeah.
And yeah, that's really good. So that has to, I guess, to do that, in order to do that, you have to have really a broad training or experience in a little bit of all of that, huh?
Well, that's what's sometimes difficult about the rural communities is we don't always have all the specialists here, or patients don't have a way to get to them if they're down in Phoenix. So that's another part of family medicine, rural family medicine that I love, is you have to kind of play this like social work role and see what you can do for the patient.
Also, to have a really good foundation of critical thinking skills, like, okay, I'm not quite sure what's going on, or okay, I identified this as the problem, now what do I do about it? So you know your resources and how to read up on it and do it in a timely and quick manner that you can go forward with some sort of treatment, at least start. And we do, as family physicians and rural family physicians, have a lot of connections, like people to call a friend. And then there is a great network called the ECHO, which Project ECHO, where you can actually consult with someone who might be in another state, and they'll help you figure out the problem.
I was just going to ask about telemedicine, and is telemedicine a big part of family medicine practice?
Exactly. So telemedicine is a great boon to rural medicine, and as rural primary care, that's an opportunity that we offer for our patients. So when Dr. Johnson, for instance, is down at the VA working for this month, he can still see his patients who are still up in Payson. Even if Dr. Johnson was here in town, but the patient didn't have a ride or whatever, we can see them by telemedicine. Not a problem.
And you, in the beginning of the program, you said you've been in family medicine for a little while.
Just a little while.
Just a little bit. What are some of the biggest changes you've seen in family medicine over the years, and what are some things that haven't changed, I guess, that are the same?
Yeah, so that again, that brings up like keeping up, right? You've got to keep up. You got to know your resources and keep reading. Like a big part of being a physician, any physician, is being that scholar every day, reading and keeping up. So what's changed? A lot of our screening has changed. We have, like, for instance, before it was just the colonoscopy that we would offer for colorectal cancer screening, and now we have a couple of other tests that are done in the comfort of your own home and mailed in.
You make it sound so pleasant.
I guess. So, you know, we have new ways of screening, we have new vaccines, we have, what else has changed?
Have you,
Ages,
the what?
Now it's 45 for.
Oh, yeah, how it's lower.
Oh, how, yeah, yeah.
Yeah, I remember being told that. I'm like, what, really? Hey, I missed that memo.
Yes.
And then how about preventative medicine? It seems like there's more of a focus now maybe on preventative medicine than there was maybe 20, 30 years ago.
Well, I hope that's always been a focus for family
okay,
doctors. And it should have been, and it has been.
Mm-hmm.
Okay. But sometimes we're chasing down the problems, but trying to fix urgent things before we can address the prevention.
Mm-hmm.
But yeah, prevention is.
And that's a great place for family medicine because a lot of those changes can't take place overnight, and you really have to have these relationships over long periods of time with your patients in order to, have the trust to take some advice that you don't necessarily want at the time. So I think that prevention starts at the family physician's office.
That's a great point. So developing that trust and relationship with the patient is central to family medicine. You really need to right off the bat quickly develop that relationship with the patient that will keep them coming back and trusting in you.
Gotcha. And two other areas, it seems like there just is more emphasis or more focus on pain management. I don't know if you really, 20 years ago, pain management, not as much, not as many resources or not as many tools maybe for pain management. It seems like now that has really
Well, we learned several years ago that chronic opioids are not the answer to pain management, right? And in fact, I think the who is that? The drug company just settled for $7.9 billion yesterday.
Gotcha.
The makers of oxycodone.
Wow.
Yep.
Wow.
So now we know that that's not a great idea.
Yeah.
We used to give chronic opioid management, and when 15 years ago, that was something I did personally. And now we reach for many other resources, and that's sort of like the last resort is to do chronic opioids. Now we'll do physical therapy, pain injections, these two are trained in osteopathic manipulation.
So then are you DOs?
Yes, ma'am.
Okay, nice. I worked for a DO here in town, and I didn't know the difference before that. I was like, DO, wait, what is doctor of osteopathy? Wait, what are you? What's going on here? And he explained, Well, that's good. And how about mental health as well? That has kind of really, I think, become more of an issue and being looked at more of a holistic approach. So with DOs, kind of that more holistic or looking at the whole body. And now with you, I guess that's what since you're so new and in this, that's a big part of the practice, do you feel?
Oh, absolutely. I mean, I think that's kind of a point she made is about a third of our patients end up addressing it because it's amazing what you can get from a patient when you just say, how are you feeling? How's everything? What's been going on in life? And then you start just unraveling many components of what they've actually been going through. And it's not usually just the one thing that they're trying to get a solution for. There's usually many layers to it.
Do you, and I think you used the term, did you say social worker, kind of like a social worker?
Yeah.
So is it easier for you, is it easier for you to talk to people, to kind of just have those casual conversations to where you kind of keep it,
I think, the first visit I always try to be pretty professional and I don't want to dig too deep. I want that connection and that trust and I want them to come back. And I like to kind of, build on our relationship, and as it goes through, I kind of start learning, oh yeah, your mom or your dad or, something like that. I think it has steps, but I have learned as a doctor, I can just say, hey, what's going on? Like I can be that nosy person, which I never really was, but as a physician like you have to.
Yeah. How about for you, Dr. Dupre? Do you find that easy for you? Does that come naturally, or?
Oh yeah, I think we're the barbers or hairstylists of medicine, basically.
There you go. You hear it all. They just let it out, right, and just tell you.
Right. I'm your physician first, but
Yeah.
throughout these relationships, I develop friends, and I really enjoy people, and people like Dr. Renner said are very comfortable in that setting, sharing things they wouldn't ordinarily share, and it's a safe space for that. So, yeah, it's part of the job, and I enjoy that aspect of it.
And I guess it goes back to the family medicine and diagnosing and just trying to get as much background and information to help you make your patient feel better.
Right. We call that the biopsychosocial model.
Whoa.
Yeah.
All right.
It's burning,
Yeah. I like it. I like it. I'm not going to remember it, but I like it. Well, it is after 10:30 actually. So thank you so much. Yeah, it was wonderful meeting you.
That's
meeting
great.
you,
It's
seeing
our
you again.
pleasure. How
I know. Thank you for taking the time to come in and share, and also remember the community meetings, community health needs assessment report that Banner Payson Medical Center is doing. Again, they want your input, so June 25th at noon at the Banner Payson Medical Center. You can go there. Again, refreshments are provided, and then there's a couple focus groups that day from 2 to 3:15 and from 6 to 7:15. If you can't make those, again, you can do the survey online, and those forms are on the KRIM website, krimfm.com, or our Instagram page, or I'm sure they're on Facebook as well, on the Banner Payson Medical Facebook page. Well, guys, thank you so much for listening and watching today. And again, hope you enjoy the rest of your day. Have a great Wednesday. Probably going to be another hot day out there, but we're going to get an update here from the National Weather Service right after a message from our sponsors, the Shed Kings. Again, big thank you to Curtis and Anthony down in Star Valley. And then back to the music with some Dr. Hook, Dire Straits, and the Smithereens. So you guys have a beautiful rest of your day.
Bye.
Thank you.